This is a 70-year-old male patient who has a complication from his surgery and he's developing infection and blood clot. And the doctor ordered a internal central line with a single lumen for antibiotics infusion and blood draw. And the central line is located in the patient's chest, and it is open line with a clamp, and it's not connected to the infusion. First, I will gather the supply and bring to the patient bedside and check for a precaution before entering patient room. Perform hand hygiene and provide privacy. Good morning, Mr. Johnson. My name is Ife. I'm your nurse today. Your doctor ordered the lab to check your complete blood count and the prothrombin time. So I'm going to collect the blood sample from your central line. Do you have any questions? Can you verify your first name and the date of birth? Thank you. Perform hand hygiene. Put on clean glove. Remove the cap from the hub. Then I'll swap the hub for about 15 seconds. And I'll let dry for about 15 to 20 seconds. Now I'm going to check the patency of the central line. Push out the extra air from the normal sealing and attach to the hub. Unclamp. First check for the blood return. Then flush. Push, pause, push, pause, push, pause, push, pause, push, pause, push, pause, push, pause. Then I'll redraw the blood. I will collect about 5 to 7 milliliter. Cleanse, detach. Discard the waste blood in the biohazard container. Now I'm going to attach the transfer device to the hub. Unclamp. First, using the blue tubing to collect for the PT. We'll collect about 8 milliliter blood. Then use lavender for CBC, and we collect about 8 milliliter blood. Invert tube for about 8 times. And detach, clamp, then detach the transfer device. Attach the normal saline and set aside. I'm going to work on my lab, and I'll use the label for the tube. And put that in the biohazard bag. Along with the lab order. and this will send it to the lab. Now I'm going to flush the saline. Unclamp. Push pause, 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 push pause. Detach. I'm going to flush the operant. We flush about 2 to 3 milliliter. Clean and detach. And put the cap back into the hub. I'm going to check for any complication after blood draw and discard the blood supply. And remove glove and perform hand hygiene. And I'll document in EHR. Now I'm going to perform the dressing change. I will gather the supply and bring the patient's bedside. Mr. Johnson, I'm going to clean your central line dressing. Please turn your head away from the insurgent side. I perform hand hygiene. Put on a clean glove. And a mask. Now I'm going to inspect and palpate the side and check for any swelling or tenderness. And I'm going to remove the old dressing. Stress the dressing outwards. Then pull the dressing upward toward to the inversion side. Discard the old dressing. And assess the side to examine the catheter and the hub and measure the external portion of the catheters to compare to the previous length to detect any migration. Remove glove and perform hand hygiene. I'm going to open the dressing kit. I'm going to put down a sterile glove. I'm going to clean the insertion side. With a circle motion from the center and outwards. Clean the central line. And the hub. And let dry. Now I'm going to put on the bioform and the transparent film. To secure, put the pressure on to secure the line. And I'm going to put the tape for the central line just to keep into place. I'm going to discard all the supply. And remove sterile glove, perform hand hygiene, and document an EHR.